theme has been the Treat Me Well campaign, which is about improving people's access to healthcare and making sure they get better healthcare if they become ill.
We've got lots of different stalls here. We've got people from Macmillan, we've got people from sexual health.
And it's really nice that we've got so many different organisations here taking part and giving us their time.
We're trying to make sure people with learning difficulties are aware they can get treatment.
I feel like I can have more help, but I need more help. It can help me to get more happier and get more involved.
1,200 people with learning disabilities die unnecessarily in hospitals.
That works out 3 people a day with learning disabilities die because of a lack of proper healthcare.
People in the healthcare professions might not know how to deal with them, how to interact with them.
When you go to the GP for me, sometimes the GP won't talk to me because they think I don't know.
They should be equipped to be able to go into hospital with, for example, a hospital passport, which is a document showing, information about yourself that you might not be able to articulate in a hospital environment that people without learning disabilities would be able to do.
So the health passport has all those things down, like how people communicate, how they show they're uncomfortable, to make the whole experience more holistic and to make sure that people get the care that they need.
It's really about knowing things, and especially things that people don't often talk about as well, things like sexual health.
We quite often don't talk about sexuality with people with learning disabilities, but people with learning disabilities are adults and they have adult feelings.
Sexual health is a part of a general health and it should not be neglected. Everyone deserves the same information. But some people have much more difficult access to it. We would like to ensure that every young person has received the same information.
I didn't know a lot of these services that are on offer, so it shows us what is available and what help there is out there for adults with learning disabilities, and very, very informative.
It's very important because there's people that are suffering within the community.
People with disabilities could be walking around with something that they don't know they've got, and so if there's information out there for them, they can then start looking for signs and symptoms.
If people don't have the information about their health, things won't change. And we'll be standing here in 20 years' time and asking why people with learning disabilities die younger than people without learning disabilities. And we can't allow that to happen. We need to give people the power to make that change themselves.